It's been a long journey, or a 10th year celebration of the Health Tech Summit, which initially was called MedTech Summit. And of course, the name change came as the industry changed as well. So with digital innovation now making an impact in healthcare, we transitioned to Health Tech Summit. And we see at the intersection of mature industries, information technology, material science, as well as medical technology evolution, new solutions for patient outcomes. So it's exciting to see that the ecosystem is growing at the intersection of the different fields, as well as from an investor point of view. I think Europe has become much more mature. We see that by the participation at the summit, as well as a number of wonderful technology companies that are making big impact. There are tens of thousands of patients benefiting from the solutions that were actually nurtured and partly at the MedTech and Health Tech Summits in the past 10 years. So bringing the ecosystem together, the industry, innovators, as well as capital, exploring synergies, helping to accelerate the most promising companies, I think is something that we can be part of as an ecosystem here at the Health Tech Summit. Digital health is an area where it has made a huge impact in all sectors in the economy. If we look at automotive, aerospace, finance, in every part of society, we're touched by it. Healthcare traditionally is quite a defensive industry, meaning that quality and patient care and data privacy and all of these issues make it that the innovations have to mature to a point where they can be adopted. The industry has been kind of tackling that over the last 6-7 years, and finally we start to see some emerging technologies that are based on digital innovation coming into the field, which have already making big impact. But also I think there's a lot more to come. I mean, this is just the beginning, where we start actually leveraging data to significantly impact patient outcomes and improve quality of care while tackling cost structure of the society. We're very excited about impact of digital innovation and next generation sequencing molecular data in the field of oncology. If we look over the last 30 years, one thing we've learned is that therapeutics can only go so far. We've all unfortunately had friends and family members who have died from cancer, and even though with therapy for the most part, it's an uphill battle. Occasionally we do have therapies that work, but for the most part we need to do a much better job of identifying patients long before they have symptoms. Symptoms are not a good diagnostic tool, and we have used symptoms far too long to diagnose people, to identify, bring people into the hospital for them to be identified as a patient. So we need to do much better job of identifying people much earlier, long before they have symptoms, and bring them into therapy. We need to do much better job of patient stratification, finding the right treatment for the right patient. We need to do a much better job in terms of follow-up and surveillance afterwards, in terms of recurrence of diseases and care of patient care. And I think since the Human Genome Project was completed, we have a whole new landscape of technologies that allow us to tackle that problem. And digital innovation, on one hand, also emergence of machine learning, artificial intelligence, combined with all of the molecular data gathering, I believe we're at the verge of significant disruption in the field of oncology, where I really hope that within our lifetime we're going to see significant improvement in patient outcomes on that. We're, for example, very interested in companies that can significantly make an impact on that. We've invested in a number of different technologies. One is essentially early identification of disease using one's own cells, immune cells, which see what's going on in the body, which react to what's going on in the body, which are involved in the defense of the body against cancer. And using what they see in the body and how they react in the body as a way to identify patients far earlier than we are able to do today. And then eventually down the line in terms of patient stratification and surveillance. So application of machine learning, artificial intelligence to big data, coming from transcriptome level is an area we're very excited about its prospect for the future. We do that several ways. We're invested as limited partners in a number of funds. So what we try to do is really understand which stage they're at and what are potentially some of the challenges that they may face down the line. We've observed the industry for 20 years. We really see all the successes and the failures, and hopefully we can provide a little bit of advice that might be helpful to them. Making the right introduction. I mean, networking is an extremely important part of this endeavor, finding the right partners that can go with you in the long term. And realizing that no successful venture is a straight line. It's never a straight line. It has its ups, has its downs, and you have very, very difficult challenges to go through. And so identifying the partners and the right team that you're going to go through this marathon together, triathlon if you want to call it, becomes an extremely important thing. So to the extent that we can support entrepreneurs on that, and of course, never give up.